discuss a topic that has got me concerned in the last few days about drugs in our schools. The last few months found me in high schools doing a research, but something else caught my attention. This was the use of drugs among our schools. And Dr. Catherine Musioka, how are you doing?
I'm very well, and thank you very much for having me. My name is Dr. Catherine Musioka Amulundu, and I am a clinical psychologist.
Clinical psychologist, not clinical. Okay, fine. Clinical psychologist.
Yes,
Thank you very
I'm
much for
a
that correction.
clinical psychologist, and
Yes.
I have specialized in the issue of alcohol and substance abuse prevention and management. That's my area of specialization. I
Perfect.
work especially with emerging adults, the young
Yeah.
adults,
Yeah.
the adults in schools and
Yes.
universities. That's my area of interest.
A few months ago, I was in some schools doing some research, and I realized there seems to be a problem. Have you also noted that from your practice?
There's a problem, and it's a big problem. I also did a research actually just the beginning of this year
Yes.
about substance use, alcohol and substance use among
Yes.
our university students as they come to university. The
Yes.
students transitioning from secondary schools to universities. And within their first week in university, when we collected this data, the
Yes.
figures we had were alarming because 1 in every 4 of the students we interviewed had
Yes.
actually experimented with some substance of abuse in their lifetime. And these
One
are people
one
as
in
young,
four.
1 in 4. And
Okay.
these are people as young as 16 years to 18 years. So
Yeah.
this is a big problem as it is,
Yeah.
because they were saying that some of them started even in primary school. By the time they're in class 7, class
Yeah.
8, they'd already
Yeah.
started experimenting with drugs. So that's how serious it is.
And any from your research, I don't know if that was part of your objectives, but how are these drugs getting into our schools, for example?
There's a lot of push for students to use drugs
Yeah.
in our schools. And unfortunately, the people who are meant to take care of these students are the same people who provide drugs to them. These are people who work in the schools.
Mm-hmm.
There could be in any capacity
Yeah.
in the schools. There
Yeah.
are shops around the schools.
Yeah.
There are peddlers who has found this to be a rich market for their substances of abuse, and they
Yeah.
target
Yeah.
young minds because these minds do not have the right information,
Yeah.
do not have the ability to say no, and they are very
Mm-hmm.
suggestible at this
Yeah.
age. So there
Yeah.
are people who are taking advantage of the young ones and introducing them to drugs very early. And
Yeah.
as we know, unfortunately, substance use, whichever way it starts, it becomes addictive at some point.
Yes.
So the
Yes.
use is not voluntary. That's the unfortunate that's the issue we find ourselves in.
Would you throw away out any common drugs you think are being peddled in our schools currently?
Oh, yes. From what we found, the use of alcohol is still a big thing in our
Mm-hmm.
schools.
Mm-hmm.
But the use of cannabis, marijuana,
Yeah.
is actually almost overtaking the use of alcohol, and also using various types of tobacco products.
Mm-hmm.
Nowadays, they have products they are calling Chavis, there are products they are calling Kuber,
Mm-hmm.
there are products they are calling Baki, and
Mm,
various other Dove,
yeah.
Dom. There are various names they are giving
Yeah.
the substances they are using.
And these are being peddled into the schools in these names, and at some point, of course, when someone tests one, then at some point they make a choice of their drug of choice, or the thing that makes them feel whatever it is they want to feel. But on the flip side, when you talk about some of those things and the names you've used, because one of them is a mother tongue name, which comes from a mother tongue, and which is also your mother tongue, these are things that our grandparents would use, like tobacco, which they used to put under their in their mouth. And I'm wondering, is this coming into children in schools now?
Yes, that's what they are using. Like the one they're calling Kuber, they actually put it under the tongue,
Yeah.
and then it gets into the body through the mucous membrane. So
Yes.
you find the youngsters with their mouth looking like it's bulging down. It's
Yeah.
because there's something which is put under the tongue, and they can have it even when they're in class. A teacher is teaching, but somebody has something. You'll see them spitting a lot because sometimes the substances
Yeah.
is bitter.
Yeah.
So looks like people are going back to the old way of doing things. But unfortunately, the form of tobacco they are using, they are not
Yeah.
pure tobacco. It's a mixture of things. Now, these are things, substances which we do not even know the chemical composition of the substances they are using. They are
Yeah.
mixing. Sometimes they have cannabis inside. They have heroin. They have even cocaine inside there, and then there are tobacco products. So it's a very it's just a concoction they are putting inside, which have found themselves into the market. And our youngsters want to experiment. They want to get that high. So there they are.
Yeah.
They're
Yeah.
using.
I think it's very scaring that you say cannabis is becoming more popular than alcohol. Then because that is very scary. So as a clinical psychologist,
Psychologist, yes.
yes, yes, that one I got. So what happens to the brain once one ingests a substance of abuse,
This is the
which then
most
leads to addiction?
yes, the most unfortunate thing is once you introduce a substance or drug of addiction into the brain, and we call these psychoactive substances because
Yes.
they interact with your brain and the way you reason, the way you appraise your environment, and the way you make decisions. It affects the brain area because the brain is a very specialized area. It is actually the command center of the human body. So it will affect your coordination, it will affect your vision, it will affect your memory, it will affect what we call the cognitive functions, the higher functions, how you make decisions and how you appraise the environment around you. So it interacts with the neurons. Those are the nerve cells which send messages to your body on what to do. And unfortunately, sometimes it kills some of those neurons, and then you find the reaction time, the decision making is altered in a big way. So the level of performance, the intelligence, the decisions our youngsters are making becomes a problem. So use of substances, no matter how it gets to the body, has very detrimental effects to the brain. And some of this damage is long lasting. And unfortunately, the human brain, the people we are calling emerging adults, in these formative years, that is the time when the brain is really developing. It makes those connections. So when it is interfered with at that point, the human brain continues to develop up to the age of 24 years.
Yeah.
That is when it gets to adult capacity.
Yes.
So any activity, negative activity on the brain around that time is very detrimental to the intelligence and to the overall growth of the brain. So we need to protect our young adults from
Yeah.
the use of substances because the
Yeah.
damage can be done.
And because I know you run a rehabilitation center, what really is it possible then to kind of reverse the damage? And to what extent is that possible? Because I have heard within rehabilitation circles that even when someone has gone through rehabilitation, you still call them recovering. And
Yeah.
so, how much of that can be reversed? Because you mentioned a very important thing about the brain.
The most unfortunate thing is once brain cells die, it's not easy to bring them back. But what happens if the damage, the control is done early? Other brain cells take over the function of the cells have been lost. So the main thing here is to identify people who need help early enough so that we can stop it before we damage a big area of the brain. Because once the brain cells die, we cannot get them back. But when you stop, then we can train other brain cells to take over the functions. Of course, it will not be 100%, but you can do something with your brain once you stop the damage, because it stops at that point, and then you continue to rehabilitate this person back to know how to learn, like how to make decisions and issues like that.
there is still a lot of stigma around psychotherapy and matters of mental health within our culture currently. What did you tell a parent who still feels like, no, taking my kid to a therapist and everything like that still is in some circles stigmatized? What is your advice on that?
Unfortunately, that is the truth. People do not even want, parents don't want their children to come to rehabilitation because they feel that it reflects badly on them. But I'll say, really, in this day and age, let's not stigmatize mental illness and mental wellness as it is. We have to do everything to have these discussions within our families, within our circles, and let it just be normal that when your loved one, your child, your husband, your sister, or anyone close to you is having challenges with mental health, that we make it possible to seek help for them. We help them to seek help. Unfortunately, what we find is substance use is a disease we call a disease of denial. People do not think they have a problem. They think they are in control, that I can stop when I want,
Mm-hmm.
like I make a choice when to use or not. But
Mm-hmm.
that is not the point. It's the people around you who should make decision for you to seek help. So we should not stigmatize, and we should take it upon ourselves to seek to help our loved ones, especially our young children, seek help as much as possible. This week alone, I have seen about 7 youngsters who have been sent away from school for psychotherapy. So
Mm-hmm.
schools now are realizing the importance of psychotherapy and seeking help for their students instead of just throwing them to the streets or expelling them. And
Yeah.
sometimes when those people come, like the parents we deal with, they are shocked. The main thing is shock that actually their children are using drugs, when sometimes they only agree or accept that it is true when the youngster actually accepts in front of their parent that, yeah, actually I'm using. You find parents who are still in denial that, no, my son does not use, I've never seen him using. But there are telltale signs parents need
Mm-hmm.
to look for
Mm-hmm.
when to understand when their youngsters are using drugs. And one of the main things you realize is just change in behavior patterns.
Yeah.
This child who was interactive with you, you find out they are quite, they want to isolate, they want to stay away from the rest of the people. You find them
Mm-hmm.
maybe in their rooms, or you
Yeah.
find them in just corners. And then with time, you realize they are not doing well in school. That is a major thing which comes. You find the child who is coming for psychotherapy as they're in Form 2 or Form 3 and they are in their third school, for example. And every school they left with a reason. And the parent does not connect that this is a problem why they left school number 1, went to school number 2, and they are struggling. And now they're in school number 3 and they are struggling. So you need to find out when your child is being moved from one school to the next. That's not a normal thing. Dig out and find why are they not able to perform in that school, or to just follow the rules and stay in that school. The other thing you find, these pupils or students, they have high need for money, which cannot be explained. Sometimes they have just reasons here and there about why they need the money and how they have used the money. Sometimes they'll tell you it is lost, what you gave me got lost, it was stolen. So those stories, when they become regular, then you need to know there's a place they're taking the money they're getting from you. There's a reason they're using this money for, and you need to investigate. Let us not be naive or not be involved as parents. As parents, we need to be there and question, because these emerging adults, they are very brilliant. They know how to get what they need from our parents, but their parents sometimes do not follow the details. They just fall for the reasons they are given, and they are not connecting the dots. Let's connect the dots early. And if a teacher tells you your child has an issue, investigate that issue. Let the adults pull together to help our youngsters. Sometimes parents are being told your child has problems relating with others, and you're thinking the school is being punitive. There is a reason why a school will pick on your child and tell you there's an issue with this child. Find out what it is and solve it early, because the earlier you start, the better for you and
Okay,
for the
so
child.
just before we get to your parting shot, maybe I should have asked this earlier, but you're a parent, and what should parents do even before we get to the place? Because they say prevention is better than cure. So what are some of the things a parent can do to make sure that at least their child has some insulation of sorts, even when these peddlers come along, they have this insulation that they can still stand and not even pick the first time.
Yes, I'm a parent. I'm a mother of 5. And
Nice.
so even as a therapist, I can also speak as a parent, having brought up, I have a 30-year-old, I have a 25-year-old, I have a 20-year-old, and I still have teenagers as it is. So dealing with parents, what I have seen, the issue of substance use or not use actually starts at home. Parents have a big role to play. So let this discussion start from home and let it start early. Have discussions with your children on what values do the parents hold towards substance use. Simple things like smoking. Do you smoke as a parent? If you smoke and your child sees you smoking, what message are you passing to that child? Because what children see, children do. Do you take alcoholic drinks, for example? And as a parent, you can take, but do you drink in front of your children? Are you the sort of parent who will take your child out to a facility and you're taking your beer as you take your meal and your child is taking their soda? You are modeling a behavior that drinking is acceptable, and because children want to do what their parents are doing. So we need to be aware that our actions actually speak more than our words. So let us create an environment where children know exactly what values their parents hold. Even as they go out there and experiment, they will know this is what my father or my mother stands for, and this is what is accepted, and this is what is not accepted. Unfortunately, we model some behaviors, and because we are adults, we can control ourselves. Maybe we didn't start drinking or smoking in our teenage years, but we are adults, we can make that decision. Now, when our children start smoking in their teenage, we want to tell them this is not right. But you're smoking. So what you're doing and what you're saying does not go together. So once we become parents, we have to know, we have to make some choices and some decisions for the better of our children, for the betterment of our children. We have to make those decisions quite consciously and have these discussions. Let us be available parents, because sometimes our children pick behaviors which we never notice because we are not there most of the time. It is a reality that we need to go out and make a living for our children. But we also need to realize that parenting is a very important role we need to play, and play it as parents. We need to create time to be there for our children, to understand them and to guide them. Sometimes children just want to come and talk to you, like somebody has invited them to take a drink. And before they make that decision, they want to hear what is your thinking, what is your take about it, and you're not available. So this child is left to make that decision on their own and to find out. And sometimes the way they find out, it's when they suffer the negative consequences. So I would say, as parents, let's take our role very seriously and be available for our children.
Thank you very much. I think one of the things you remind me is someone who said that while you are busy making a future for our children, you should be able to, or rather, when we are busy preparing a future for our children, we should also be more careful to prepare our children for the future. And I think one of the ways to prepare them for the future is to make them able to stand even when these things come their way. And then you also remind me something about the family systems theory, which states that the family is a system, and that when one individual has a problem, then the whole family has a problem. Or when the family within the system there is something that, like you mentioned, is not going in well, then this could be expressed or manifest as a problem in another person. So thank you very much, Daktari, and I would allow you to make your parting shot, and then we pick it from there.
Thank you very much. My parting shot is actually when you see our youngsters using substances of abuse, it's a call for help. It's a sign that there's a problem in that system. So as a parent, that is not the time to be reactive. Let us take a pause and see where have we failed in this journey, and then we pick ourselves up because there is hope. We run the Fountain of Hope Addiction Treatment Center. Seek help for your child. Come and get psychotherapy. It's available. Those who need treatment, let them even take time off from school to come seek and get the right form of treatment. And then from there, they will continue. Because like we've said, really, when damage is done, then it's very difficult to undo it. But you can stop the damage, and then you start doing what we call damage control by rehabilitation. Help is available. Please seek and accept help and talk to the professionals. We are here to help you. Thank you very much.